Good afternoon, everyone. This is Christine at Health Current, and thank you for joining us today for the documentation and program closure open forum. This presentation is provided through a shared commitment between Access, Health Current, and Myers and Stofers to increase participation in the Medicaid Promoting Interoperability, or PI program. Just a few logistical reminders for today. The open forum will be recorded and posted to the Health Current and Access websites. We encourage you to use the chat box for questions or comments throughout today's presentation. Please include your name, your practice and organization, and do not include any confidential information such as patient health information or PHI. We are going to be muting all lines today, so again, we encourage you to use the chat feature throughout today's presentation. Connie, are you with us?
I am, Christine. Thank you.
Wonderful.
I'd like to let you all know that Priscilla Clark, a manager at Myers and Stouffer, a certified public accounting firm specializing in federal and state Medicare and Medicaid programs, is our open forum presentator for today. So take it away, Priscilla.
Thanks, Connie. So today we're going to be just talking about program closure and just the end of program. What are the deadlines like? What are next opportunities after the Promoting Interoperability program ends? So if you have any questions about those types of things, as I start to talk about the deadlines and various other programs and opportunities, feel free to put in any questions in the chat box, and we can help to answer those questions on this call as possible. And if we do have time towards the end of the presentation, I may show you some just documentation requirements and things that will be required, and just some of the things that you'll have to attest to for the Promoting Interoperability program. So this is just a timeline to help you to keep everything in mind of when things are starting, when things are ending. As you are probably well aware, program year 2020 and program year 2021 is currently open for attestations, and that does close, as you can see, on October 31st, 2021. So make sure to keep in mind that you will have to attest by December 31st, 2021. Okay, if you do not attest and complete your attestation, there's not a chance for you to receive a payment for either of those program years. Access is currently in the process of reviewing attestations and will continue to review those attestations through the end of November. As you can see, EPs must submit all requested documents. If you've been a part of this program, you're probably well aware for the past 2 program years, documentation requests are sent out to providers who are missing documents, who do not upload all the sufficient documents during the attestation period. And so be aware that you may be receiving those from Access, requesting additional documents that may need to be submitted. As you can see, that timeline is will be from today, is the earliest you could receive a documentation request, up until January 14th, 2022. January 14th, 2022 is going to be the last date that you can submit sufficient documents for the prepay process. And so, as you can see, there's a couple key deadlines that you need to pay attention to throughout this entire timeline. There is, when it comes to attesting and reviewing documents, as you can see, on November 30th, there's a notice of decision issued. So Access, the prepay team, will have decided by then, okay, what is the decision based on your attestation? And so there are a couple scenarios that you can fall into that we'll discuss in the next slide. But if you are rejected for payment, you will receive that rejection by November 30th. And EPs must submit their appeal request the earliest of 30 days from the date of the notice of decision, or by December 31st, 2021. So if you receive a notice of decision saying that you've been rejected for payment on November 15th, you have exactly 30 days to request an appeal. If you wait past that 30 days, which would be around December 14th, December 15th, you lose the right to appeal that decision. So make sure you're paying attention when Access reaches out to you and that you're responding quickly and making sure you meet all the appropriate deadlines. Up until that point, of course, up until November 30th, and even past that, you will potentially receive a documentation request. And there's going to be deadlines on that documentation request. You want to make sure you're submitting those documents in a timely manner. As you can see, on December 31st, 2021 is the deadline for all payments. So Access will have by November 30th reached out to you and let you know whether you're receiving a payment or there is a denial. And all payments will be processed by 12/31/2021. Now keep in mind, if you are one of the providers that appealed, you may not receive your payment until after 12/31/2021. Keep in mind that key deadline of January 14th, you have to submit all your appropriate documents that have been requested to date. There's also the EP appeal request on that fourth row, so you can see it starts in December and then it ends on December 31st, because you have to have requested that appeal within either 30 days or by December 31st, 2021, whichever one's the earliest. So keep in mind, at any point, Access can potentially be reaching out to you once you've attested and saying, hey, please request appropriate please submit the appropriate documents, and if you don't submit those appropriate documents, Access may reject you for payment, or, so make sure you're communicating with Access. A few other timelines to be aware of is Access will review the appeals the beginning of next year. They may start the end of this year a little bit, but just keep in mind that they will be regularly communicating with you, whether you're in the appeal process or just in the attestation process and submitting appropriate documents and you haven't been rejected for payment. So the prepaid team will be reaching out to all the providers attesting from today, if not sooner, up until next April, if you are in the appeal process. But make sure you're submitting all your documents in a timely manner. And then also you can see on the last row that there are post-pay audits that will be starting in February of 2022, and it can go all the way until September 2023. So again, make sure you're maintaining your documents, make sure you're responding in a timely manner, whether that's the prepay or the post-pay team, to make sure you're submitting sufficient documents. Keep in mind for the 12/31 payments, potentially there is a scenario where a provider would receive a conditional payment, which is made prior to demonstrating that the EP meets the program requirements. So as I told you, the prepaid team is reaching out to all providers by November 30th and saying, okay, you're either receiving a payment or you're being rejected for it. When you come into the scenario of you are receiving a payment, you could potentially, if you submit all sufficient documents, be receiving a payment and you're good to go. But there is a second scenario inside of that where if Access lets you know that you have received a conditional payment, that means Access will be paying you the amount that you are owed by 12/31. However, you still have to submit sufficient documents for that money not to be recouped and taken back. So pay attention anytime Access is reaching out, because there is a possibility that you're going to be given a conditional payment. And that condition is going to be that you submit the documents requested in the documentation request. Again, if you have questions about that or want to walk through a scenario, feel free to put that in the chat box and we can walk through that. Okay, so payments for these program years. So there's a notice of decision letters, which will be mailed to EPs by December 1st, 2021. So keep in mind, they're going to be reaching out to you and letting you know what that decision is. Will you be paid? If you will be paid, is it going to be a conditional payment? And then also, if you're going to be rejected for payment, they're going to let you know that by December 1st, which means you have 30 days to respond and request an appeal. So the following decisions may be identified on that notice of decision letter. The first one is a payment. The message will be posted in Epip. It's not a conditional payment. It's just a regular payment. You've submitted the sufficient documents and passed all the prepayment procedures. You may still, of course, be required to be selected for a post-payment audit. There's still that possibility for all providers. So keep that in mind and make sure you're maintaining all your documents for the foreseeable future. The second type of decision is a conditional payment. So if EPs do not submit appropriate documents during attestation, Access will potentially send the EPA payment that is conditional on the EP submitting the required documents. Payment will be recouped if the requested documentation is not submitted by January 14th, 2022, or if it is determined that the EP did not meet the program requirements. And then the third notice of decision that could be identified is a denial of payment. EPs must submit their appeal request the earliest of 30 days from the date of notice or by December 31st, 2021. If an appeal is not requested within the 30-day time frame, the matter is closed and the decision remains, which means you are not able to appeal, and that means that you will not receive a payment for those program years. or still underneath that appeal request. The prerequisite, of course, to go into appeals is that an adverse decision resulting in denial occurs. And so either that's you're completely rejected for payment or you only receive a certain percentage. So make sure to pay attention to those notice of decision letters because that time frame is going to be very important to appeal within that 30 days or by December 31st, whichever one is earlier. Your request will be sent to this address that's on the screen. And as Health Current has already put in the chat box, a copy of the presentation will be sent to all attendees, so you will have access to that address, as well as it should be sent to you when the notice of decision letter is sent out, letting you know that you are rejected for payment. So there are some barriers to payment. You know, we're dealing with Epip and as Access is processing payment. There are certain things on the provider's plate that they need to handle when attesting and to make sure that these barriers that we are about to highlight do not occur for you because all payments have to be made by December 31st, 2021, unless you're on appeal. You want to make sure none of these things hold up your payment. So you need to make sure CMS registration is correct, that your Access Provider Enrollment Portal is correct, that everything's matching up. Does your payee name match up? Do you need to update it for a specific provider? So if a provider was working for Practice A in 2019, you may need to update that payee name if that provider switched to a different practice and started working for Practice B, and the payment needs to be sent to Practice B. Just make sure everything's lining up when it comes to the administration piece of it. Also, electronic funds transfer account. Make sure your account is correct when it comes to receiving that payment electronically. Also, CMS registration. So check your payee MPI and your TIN for accuracy. You want to make sure that everything is accurate so that nothing's going to hold up your payment towards the end of the program. This program year 2021 is the last program year to receive a payment. Also, make sure your Access Provider Enrollment Portal is correct. Set up an account if you do not have one. Modification or update requests are no longer accepted via paper. You can't do a paper attestation or a manual one. You need to make sure you are able to go through the Epip portal and attest. And that all your information is correct. So make sure all necessary changes are set up, your payee PIN, your name, anything else that might have changed or may need any updating. And then, of course, make sure your electronic funds transfer account, check your payee MPI and PIN and Epip for accuracy. You want to make sure everything is lined up. So if you have any concerns, make sure to fix that. If you have questions or you need help with something, feel free to reach out to Access and they can help you to make sure everything is set up correctly. Okay, for the Epip system specifically, the attestation deadline is October 31st. It's not November 1st, so make sure you're testing early. Go ahead and start that process now. Make sure if you have come across any issues, you're handling it now versus last minute. There will be no paper attestations for program years 2020 or 2021. For payment activity, you can view your payments under the My Account screen. If you have issues with that, again, you can reach out to Access and you can email them at the email that's listed on this slide. Now, keep in mind that your system access to Epip remains until September 30 of 2023. So when it comes to if you're selected for a post-pay audit, you can potentially still access your Epip account and potentially the documents that have been uploaded into the system. But again, make sure you're keeping track of all your documents that you've uploaded, that you're maintaining your documentation because post-pay audits will not end until September 30 of 2023. Also, as the prepayment team is processing all these attestations, you want to make sure you're still maintaining all your documents that you've uploaded into the Epip system or that could be in your CERT to make sure you can show and support that you meet the requirements of the program. When it comes to post-pay audits, they will start in February 2022 and will be completed by September 30th, 2023. There will be a post-pay audit webinar scheduled for September 30th, 2021 that will discuss specific documentation that may be requested during a post-pay audit. This will be the last webinar that will be presented on in regards to the Promoting Interoperability program. So if you have any questions, definitely feel free to either we can discuss them during this webinar or bring them to this last webinar for the post-pay audit. And of course, you can still reach out to Access team and ask that if you have questions or concerns when it comes to prepay or post-pay procedures. Now we're going to discuss the health information technology opportunities and just things moving forward, as well as looking back and how much this program has grown. So some of the objectives for the PI program, so Congress appropriated $46.8 billion in high-tech funds for this program. There was a 10-year project period for program years 2011 through 2021. So I'm sure you're aware providers can receive up to 6 payments in this program. You probably have maxed out some of your providers. Some of you are about to for program years 2020 and 2021. But there was a 10-year project and period to help these providers start to implement certs at their practices. And so this program did encourage adoption and meaningful use of EHRs. The program also helped improve the quality, safety, and efficiency of patient health care because there was a lot of checks and balances inside of EHR systems as providers were entering in for information for each of the patients. Some of the achievements of the PI program, so the use of EHRs that has grown significantly over that 10-year period. The exchange of health information electronically. You're able to transfer from practice to practice or from the doctor to the patient. There's better quality and safer care for patients from implementing these certs. Patient engagement accessibility to health information has increased because patients are not able to access their health information electronically versus it all being in paper records. It also improved the data integrity. That was all being stored electronically instead of having to go through a bunch of data files to try to find it manually. So as you can see, there's been a lot of benefits to this program over time. Payments dispersed has been up to $296 million. And then also there was an environmental scan study that we will discuss in a few slides just about the program and how much it has grown, especially when it comes to achieving better health care. This is just a summary of the payments dispersed in the state of Arizona. It separates it out by EPs and EHs. So the number of payments for EPs was 7,734 payments to date. That's not, of course, the total payments in the entire program because we're still processing program year 2020 and program year 2021 payments. For AIU payments, the total amount of dollars was over $86 million. And then for MU payments, it was over $32 million. And then in the far right column, it does show the total payments. For EHs, there has been a total of 248 payments. And keep in mind, when we give this number, that's the number of payments. It's not the number of hospitals that have tested in the state of Arizona. The number of AIU, or the amount of AIU payments paid out to hospitals was over $76 million, and then the number of MU payments to hospitals was over $100 million. So overall, the state of Arizona has helped providers test successfully and receive payments for over $296 million throughout this 10-year program as it's been processed. And that number, of course, will increase as we process program years 2020 and program year 2021 payments. When it comes to eScan, environmental scan, which I will refer to as the eScan, this was an opportunity for providers, participants, anyone familiar with the program to respond and just give updates and just their personal preferences and just their history with the program and how they've seen it improve healthcare and just where providers came from. Because this program started back up in 2011 and it is now 2021. And so there's been this long time span of providers attesting to a program, moving from manual paper records to electronic records and how that has been processed in the system. So this is just a timeline of how that approach was taken. So it started back in November 2020, the kickoff meeting was, and just like what type of methods were going to be used as we gathered information from participants in the program. And so Access reached out to those participants back in December of 2020 to identify those stakeholders or those participants that provided information and did provide just what has happened over time. And so those participants and stakeholders, they were able to fill out an online survey. There was also group and individual interviews, as well as other data sources that were used to determine just that environmental scan, to determine what has happened over time, what are the things that we've improved on, And then in May through June of this year, they identified those common themes from the stakeholders and just gathered it all together, did charts, tried to determine, hey, what's the most important information here? And then they submitted their findings. So here's just a summary of the results. So the survey, there was a 30% survey response rate, and it was distributed to over 800 stakeholders, which is those participants in the program, people who are testing for various providers that had the opportunity, anyone familiar with the Promoting Interoperability program. There were 245 valid surveys completed, including 225 of those being for access providers. So those doctors and nurses and those providers that were receiving payments through the program and attesting through the Promoting Interoperability program. And then there were 6 areas of focus done during those surveys. So demographic, EHR adoption, the Promoting Interoperability program. They also did the HIE, which is the Health Information Exchange program, the Targeted Investments program, and then also SCOH. And then there was kind of the interviews and group discussions. There were workshops that stakeholders were identified from information gathered in previous engagement activities. They were grouped into different areas. There was quite a few telephone interviews, just talking back and forth and trying to get even more information based on those survey responses. And then there were 63 individuals who participated. And so as you can see, there were a lot of people that participated throughout this program and then provided feedback on the various surveys. And so this EHR adoption health information, these are some of the graphs that were created for that environmental scan. And as you can see in this chart on the left-hand side, it's talking about the methods of storing medical records over time. You can see in the bottom of the table, it starts in 2007, and it goes all the way out to 2020. And on the left-hand side of the chart, it goes from 0% to 100%. So how many records were being paper versus electronic? And so as you can see, that burgundy line is the paper files only. And in 2007, it was at about 50% were paper records at the various practices. And then you can see it just keeps dropping and dropping and goes drastically from 2010 through even 2011 or 2014. It significantly dropped because of those electronic health record systems being implemented because of the Promoting Interoperability program. And then that top line, you can see the green line, it shows this is the EMR alone or in combination. So it's showing, okay, what was uploaded into those certs and how quickly did they transfer the data over when it came to that. And then the right-hand side, it kind of shows just what was the data exchange methods by information. And so as you can see, there can be definitely some improvement over time. But as you can see, I mean, there has been a significant increase in moving from paper to electronic records. And so there's those patient care summaries and then COVID lab results and how are those transferred? So it kind of shows for patient care summaries, there was a 9% that wasn't exchanged. So it wasn't exchanged between practices. Then there was a 41% right there with fax and U.S. mail. So it was done manually, being submitted back and forth as patient care summaries. And then other electronic methods or online portal is those blue highlights. So that's 13 and 16%. So it's showing that they are doing and submitting patient care summaries electronically some. And so there's a lot of data that was able to come from this and just seeing the impacts over time when it comes to these programs and helping improve healthcare. And just kind of generally specifically for the PI program, you can see for the environmental scan, they did cover on the left-hand side, you can see they covered program years 2011 through 2018. And that was because of when the environmental scan was done and not having all the data for program year 2019. You can see the number of EPs over time that have attested and the number of hospitals that have. And then also just the perspectives and opportunities of the PI program is successful. The EHR adoption was high. It was over 90%. And then nationwide states are seeing providers withdraw due to HIE and stage 3 requirements, which I'm sure you're all aware of. As you shifted from modified stage 2 to stage 3, there was additional requirements you had to meet, which did make it a little bit harder for certain providers to meet those requirements. And then the opportunities, HealthCurrent can continue to promote and offer trainings for HIE measure and even offer assistance in meeting measure thresholds and requirements as you move throughout. And then just kind of a brief summary of the HIE achievements over time. So For the Health Information Exchange, there are onboarded participants for each milestone. And as you can see, there are about 5 milestones. Some of them are combined with just a modified. For example, milestone 3, there's a modified milestone 3. But these are the general high-level numbers. For milestone 1, 757 participants onboarded. And then moving through milestone 2, there's 237. And then that increased to 506 for milestone 3. Milestone 4 had 188 participants. And then milestone 5 had 275 participants that onboarded. And there was definitely a broad spectrum of provider types participating in each milestone. There were training webinars and then also interoperability initiatives via Health Current, like the electronic prescription of controlled substance, the closed loop referral, which is under development currently, and then also the advanced directives registry, which is under development as well. Just for conclusion remarks for the PI program, so it does end and it officially concludes on December 31st, 2021. However, providers will still have access to Epip through September 30th, 2023. And when it comes to interoperability, it's just the continued operation and meaningful use of EHR. So as providers, they can continue to use these systems that has been helping them for the past decade. Also, just partnerships with Health Current, and then also when it comes to Contexture, there was a merge of Corco and then also Health Current HIE as they're moving forward. So you can see a lot of things have changed over time, and there's been a lot of improvements that have occurred. There's just some other access initiatives and opportunities as we move forward. So even though the PI program is closing, there is a lot of other things that can, or programs that providers can participate in, which is going to be a great opportunity for you. So just because December 31st, promoting interoperability is closing, that doesn't mean there's not a lot of other programs that are available to you through Access and Health Current. So some of the ongoing initiatives that we're going to talk about is aimed at building a more cohesive and effective healthcare system. So there is this website that I'm going to pull up and show you of just the different opportunities that are out there and where you can go. And so when this presentation is sent out to you, you'll be able to click on the hyperlink and I'll take you here, which is various programs and initiatives that Access has out there. And so you can look through these different programs and see what could apply potentially to your practice and to the patients that you see and how it can better assist them and provide even better health care to the patients that come to your practice. And so there's quite a few programs, as you can see, I'm scrolling through these, that you can click on and even gain more information about if you're interested, if it applies to you. Of course, if you have additional questions about any of these programs, we can absolutely connect you with the right contacts and making sure that your questions are answered. Some other quick highlights to talk about is the payment modernization and then the targeted investments program. And so those were both on that website I just showed you, which has more information on it. For payment modernization, and that is also a hyperlink that would take you straight to the page regarding that program. And the mission for this program is to leverage the Access managed care model toward value-based healthcare systems. So it's a value-based purchasing strategy. There's also the alternative payment model, the differential adjustment payments, the directed payments, and the performance-based payments. And to keep in mind, there's just a lot to do with the various programs. So as you research that to see what may be applicable to your practice and beneficial, you may come up with additional questions, and always feel free to reach out to Access and Health Current down the road if you have those questions. There's also the Targeted Investments Program, which is financial incentives to develop systems that integrate and coordinate physical and behavioral health care. So it's a 5-year project period. It's from program year 2017 to 2021. So if you are interested in that program, definitely reach out to Access and ask additional questions. There's still opportunities with this program. So we're going to quickly go over just some resources and just where you can go and what's going on over the next few weeks. There is an open forum on September 30th for the post-pay audit focus. This hyperlink you can click on and register for that webinar. Again, keep in mind, if you have any questions currently about anything I've just shared, feel free to put something in the chat box and we can talk about any questions or any confusions that you have or just information that you would like to know or you are curious about. Here's the contact information if you do have any questions after we end this webinar. Of course, there is the Arizona State Immunization Information, the electronic laboratory reporting, syndromic surveillance, the Arizona Cancer Registry, in general, the Access PI program, so the EHR incentive payments at azaccess.gov. There's that email, or you can call. Just any questions that you may have, and then also at the very bottom is the health current information. If you have any questions about any of these programs we're talking about, or deadlines that are coming up, feel free to reach out and ask any questions you may have. I do want to also share another presentation which talks about documentation, but I mean, y'all did it. We are nearing the end of the program, but a special thanks to everyone for participating in the PI program. And if you do have questions, always feel free to reach out to Access. And then I'm also about to share a different presentation just talking about documentation requirements. Give me just a moment and we will switch over to that one. Okay. So this is also just talking about the various requirements in the program. If you are still attesting for program year 2020 and program year 2021, keep in mind there are a lot of requirements you have to meet for stage 3. Those requirements are very similar for program years 2020 and program years 2021. You can see right here just the changes between the two programs, but besides that, they do stay consistent. So if you are in your 4th payment, you've only received your 4th payment in the program, keep in mind you can receive up to 6 payments in the Promoting Interoperability program. So there's still that opportunity to attest by October 31st for program years 2020 and program years 2021. Some of you haven't received your full 6 payments in the program. So kind of just summarizing the differences between the two programs, the first one is the PI 90-day reporting period. So it's 90 days in both program years. However, for program year 2020, that 90-day period must start and end between January 1st, 2020 and December 31st, 2020. For program year 2021, however, that 90-day period must start and end between January 1st and October 31st, 2021, because attestations do close October 31st this year. So that's your last date that you can have your 90-day PI reporting period. For the CQM reporting period, the same concept applies. For program year 2020, it could have been anywhere inside that calendar year, but for program year 2021, it had to have started and ended between January 1st and October 31st, 2021. So the SRA completion date, rule you may well be aware of is the SRA must be completed on or after the end of the PR reporting period, but no later than December 31st of that program year. That rule applies to program year 2020 and even a couple of program years prior to that. However, for program year 2021, the SRA must be completed within calendar year 2021 and no later than December 31st, 2021. Now, if you recall that timeline I showed you at the beginning of this presentation, you have up until January 14th, 2022 to submit all sufficient documents. Now, if you can submit those documents ahead of time, great. You want to get those documents in so that the prepaid team can review it and let you know if anything is missing. But if your practice protocol is to complete the SRA and data on December 31st, 2021, keep in mind you'll be able to come back from the New Year's holiday and then submit your SRA if need be. And that's kind of your process of completing your SRA at the very end of the calendar year. Of course, you can still submit on December 31st. That's up to you. But just make sure you're paying attention to these dates and when those requirements are implemented for each program year. Here's just a general slide of the meaningful use requirements. Of course, it does not identify the eligibility requirements. At the very bottom of the slide, you'll see another hyperlink, and that takes you to the documentation retention presentation, which does talk about the eligibility requirements. When it comes to just meaningful use, the general requirements, all EPs are required to attest to stage 3 of MU for program year 2021. All EPs must have 2015 edition cert implemented. And there are 8 objectives, and their related measures must be met. Out of those 8 objectives, 5 of those objectives are percentage-based, and 3 objectives are yes-no measures. If exclusions are selected, the provider must meet the exclusion criteria. EPs must report a minimum required number and type of EPQM. They must maintain at least 80% of all unique patients' data and cert, and then they must perform at least 50% of all encounters at locations with cert. Here's just a general table for the stage 3 objectives. So as you can see, there are 8 objectives. It lists out the names of the objectives, the type of the measure, is it a yes, no, or percentage based. It talks about the documentation. So you can kind of see there's, where it just points you to a specific webinar because there's a lot more detail behind what that documentation has to look like. Or it says, hey, it's a percentage-based measure standard or a yes-no standard. And when it comes to that, you can definitely click on those webinars in the far right-hand column to see what that's referring to and what is that standard that you have to submit for percentage-based measures versus yes-no measures. So we're going to walk through each of the objectives and just do a brief high-level summary of what is that objective to make sure you're familiar with it. So for objective 1 is the security risk analysis. This is when you protect electronic protected health information created or maintained by the CERT through the implementation of appropriate technical, administrative, and physical safeguards. This is your security risk analysis that has to be dated within a certain time frame, that the practice completes, and it applies to the entire practice, not just that one provider that's the testing. It has to do with all the data at the practice that needs to be protected. Objective 2, electronic prescribing. This is to generate and transmit permissible prescriptions electronically. As you can see, this is a percentage-based measure, and they have to meet a minimum threshold for that PI reporting period. For objective 3, that is the clinical decision support, commonly referred to as CDS. And this objective is to implement clinical decision support interventions focused on improving performance on high priority health conditions. And EP must satisfy both measures for this objective through a combination of meeting the thresholds and exclusions. Objective 4 is a computerized provider order entry, otherwise known as CPOE. And the objective is to use CPOE for medication, laboratory, and diagnostic imaging orders directly entered by any licensed healthcare professional, credentialed medical assistant, or a medical staff member credentialed to and performing the equivalent duties of a credentialed medical assistant who can enter orders into the medical record per state, local, and professional guidelines. And this is also a percentage-based measure. Moving on to objective 5, which is patient electronic access. This objective is that EP provides patients with timely electronic access to their health information and patient-specific education. This objective has 2 measures, and EP must satisfy both measures for this objective through a combination of meeting the thresholds and exclusions for each measure. Again, if you have any questions, feel free to put them in the chat box, or you can request to be unmuted if you need to voice out your question and vocalize it so that we can answer it effectively. Moving on to objective 6, coordination of care through patient engagement. This objective is to use CERT to engage with patients or their authorized representatives about the patient's care. An EP must meet the minimum threshold for 2 of the 3 measures or meet 1 of the 2 available exclusions. The exclusions for all 3 measures are the same. If the EP meets 1 of the exclusions, the EP can meet the exclusion for all 3 measures. For objective 7, the objective is the EP provides a summary of care record when transitioning or referring their patient to another setting of care, receives or retrieves a summary of care record upon the receipt of a transition or referral, or upon the first patient encounter with a new patient, and incorporates summary of care information from other providers into their electronic health record using the functions of a CERT. Again, the EP must attest to all 3 measures and meet the minimum threshold for 2 of the 3 measures. For objective 8, this is the public health and clinical data registry reporting. This objective is to get EPs in active engagement with a public health agency or clinical data registry to submit public health data in a meaningful way using the CERT, of course, except where prohibited in accordance with applicable law and practice. An EP must satisfy 2 of the 5 measures for this objective. If EP cannot satisfy at least 2 measures, the EP may still meet the objective. If the EP qualifies for exclusions from all measures, the EP cannot meet. Here are the available registries in the state of Arizona. So you can see on the far left-hand side of the table, it talks about, it numbers off what is each measure, 1, 2, 3, 4, 5. The next column talks about the measure name, the immunization registry, syndromic surveillance, electronic case reporting, public health registry, and then clinical data registry. In the next column, it talks about the available registry in that state. So as you can see, for immunization registry, you have the Arizona State Immunization Information System. But then the far right column, you see the available registry number 2, there's nothing there because there's only one immunization registry available in the state of Arizona. For syndromic surveillance, you can see that there are no registries available to EPs. Same thing for electronic case reporting for Measure 3. But then for Measure 4, for public health registry reporting, you can see that there is an Arizona Cancer Registry. However, it is only available to EPs with specialties such as dermatologists, hematologists, medical oncologists, things like that. And it does show those specialties at the very bottom of this slide. And then the patient must also treat more than 100 cases per year. If a provider does not meet these requirements, they are not able to attest to the cancer registry. So make sure to keep in mind what those requirements are and make sure that EP meets them. Also, for the far right column for the available registry for number 2, it does identify that you should be able to research national public health registries related to your specialty. So that is on the providers to go out and look for public health registries. Same concept applies to clinical data registry reporting. We do have links for the clinical data registry reporting, identifying a list of registries for program year 2021. That kind of identifies, hey, what registries out there accepting data, and then that's for you to go and look at that list and say, okay, this is my specialty, it lines up with this registry, so maybe I can submit data there, and then that's on the provider to go and reach out to that registry and submit data. Keep in mind that for the public health registry and the clinical data registry, EPs may choose to report on up to 2 registries and count each registry towards the 2 measures required by the objective. So for example, if a provider is submitting data to 2 public health registries, so the cancer registry and then let's say a pediatrician registry because this provider is a pediatrician, well, that provider is submitting data to 2 separate public health registries, therefore that counts as being 2 measures, and that meets the minimum requirements for this objective. Moving on to clinical quality. Electronic clinical quality measure uses data electronically extracted from the CERT and/or health information technology systems to measure the quality of healthcare provided. The Centers for Medicare and Medicaid Services uses eCQMs in a variety of quality reporting and value-based purchasing programs. Hospital professionals and clinicians use CQMs to provide feedback on their care systems and to help them identify opportunities for clinical quality improvement. CQMs are also used in reporting to CMS, the Joint Commission, and the commercial insurance payers in programs that reimburse providers based on quality reporting. The definition of CQMs for the PI program, EPs must attest to 6 out of the 47 available CQMs. 6 are outcome measures, 27 are high priority measures, and then 14 remaining measures. Providers have to try to attempt at least to meet priority level 1 first, which is, if relevant, at least 1 CQM should be an outcome measure. Priority level 2, which is the next scenario the providers should fall under if they can't meet priority level 1, is if no outcome measure is relevant, at least 1 CQM should be a high priority measure. And then moving on to priority level 3, if no outcome or high priority measures are relevant, you report on relevant measures if possible. Regardless of these priority levels, in the end, the provider still must attest and meet 6 out of the 47 available CQMs and be able to attest to them. Again, this is just the resources, which I already showed you in the first presentation about the post-pay audit focus webinar on September 30th, as well as all the contact information for the various departments at Health Current, ADHS, and Access. So just keep in mind, if you do have questions down the road, definitely feel free to reach out to any of these departments. If you have questions right now, please feel free to put them in the chat box and we can discuss. And Christine, I will hand it back to you unless someone has any questions for me.
Thank you so much, Priscilla. Again, the chat box is open, or if you raise your hand, I'm happy to take you off mute and you can ask your question directly to Priscilla. So we'll pause for a few minutes and see if anybody has any questions or would like to raise their hand. And just a reminder to everyone that a copy of this presentation will be sent to all attendees and the recording will be posted on the Health Current and Access websites. Looks like we have someone that raised their hand. Eileen, hang on just one moment. Eileen, I think you can unmute yourself at this time. Oh, okay. Looks like somebody may have already explained it to you, whatever your question was. I'm sorry, but again, we're happy to answer those questions and take you off mute if you'd like. Eileen, you're very welcome. Again, we're just going to pause for another minute or so and see if any other questions come through the chat. Priscilla, I am not seeing any additional questions or anybody wishing to raise their hand, but I would like to thank you for sharing the information about the documentation and program closure open forum for the Medicaid Promoting Interoperability PI program today. And again, the presentation will be sent to everyone and the contacts are in there. Please do not hesitate to reach out to Access, Health Current, Myers and Stofers to get your questions answered. That will conclude today's presentation. Thank you again for attending, and we'll look forward to the next presentation for the Promoting Interoperability PI program on September the 30th. Thank you all for joining us. Have a wonderful day.